Good afternoon. Welcome to the Joint COVID Task Force. We are going to start with a few slides. Total COVID-19 cases reported to date during the pandemic, 236,036. New cases reported today, 205. Next slide. Of those new cases, 28 are pediatric cases. As you can see on this graph, new case rates have declined for all ages, including children 17 and under, quite rapidly since mid-January. Next slide. The 7-day average of cases per day is now 191. That is down significantly from the 458 average we reported 2 weeks ago. The 7-day average test positivity rate has also decreased since last week. It is now 4.5%, down from 13.2% 2 weeks ago. Next slide. The effective reproductive number, or RT, of the virus is now 0.56, down from 0.62 2 weeks ago. Total COVID-19 positive hospitalizations as of Sunday, February 6th, 226 with 40, and I'm sorry, that's probably the wrong date, but the most recent hospitalization numbers are 226 with 46 in the ICUs and 180 in acute care. This is a significant improvement over hospitalizations just 2 weeks ago, when 394 COVID-positive persons were hospitalized, with 86 in the ICUs and 308 in acute care. Next slide. Currently, there are 1,996 active cases in Shelby County, down from 2,937 active cases this time last week. Active cases among children aged 0 to 17 have dropped to 220 this week, compared to 310 last week. Active cases have declined across all age groups, with the highest number of active cases among the 75 to 84-year-old age group. Pediatric cases now make up 25.7% of all active cases, but are declining steadily. Next slide. This map shows active cases by zip code, with darker areas representing areas where there are more active cases. Next slide. And this map shows active pediatric cases by zip code, also with darker areas representing more active cases among our pediatric cases in those zip codes. Next slide. This graph compares average case rates of children aged 5 to 18 years old in the 6 metro counties of Tennessee. Shelby County, shown in blue, has continued a downward trend that began in mid-January. The other metro counties have also seen decreases, while Sullivan, Knox, and Madison counties still have the highest rates. Next slide. This graph shows vaccinations by vaccination date, with first, second, and third doses shown in differing shades of blue. In the past 7 days, 2,643 vaccinations have been given in Shelby County. An average of 378 vaccinations were given each day in Shelby County over the past 7 days, a slight increase over the daily average of 347 we reported 2 weeks ago. Next slide. Here, you see the breakdown of the vaccinated population by age. 59.5% of Shelby County's overall population has received at least 1 dose of vaccine, and the percent fully vaccinated, having completed the series of 2 doses or more, is 51.6% of the population. The aged 65 to 74 population is the most heavily vaccinated, with 80.4% fully vaccinated, and 89.2% in that age range have received at least 1 dose. 28.8% of children aged 5 to 17 are now fully vaccinated. 70.8% of the overall population aged 18 and older has now received at least 1 dose of vaccine. That is an important milestone set last year by President Biden. 61.6% of the 18 and older population is now fully vaccinated. having completed the series of at least 2 doses. Next slide. Last year, the COVID-19 Joint Task Force set a goal of vaccinating 70% of the entire population of Shelby County, and we are now closing in on that goal. More than 472,822 residents are now fully vaccinated, representing 51.6% of the total population, and 59.5% of the total population has received at least 1 dose of vaccine. As you can see, we are still making steady progress toward our goal each week. Next slide. As the availability of home testing kits increases, the Shelby County Health Department has made it easier for citizens to report the results of their home test kits on our shelby.community website. A link to a fillable web form is located on the site as a drop-down under Testing and Treatments button at the top right of the home page. The form is easy to complete and sends results directly to the Health Department's COVID response unit. People without internet access may report their home test results by calling the Health Department's COVID-19 hotline at 901-222-MASK or 222-6275, Monday through Friday from 8 a.m. to 4:30 p.m. Next slide. And finally, today, the Health Department is proud to announce a partnership with the Memphis Grizzlies to provide COVID-19 vaccines at the Rock and Soul Museum adjacent to the FedEx Forum on Monday, February 28th from 5 p.m. until tip-off at 7 p.m. The first 100 people vaccinated will receive 2 terrace-level tickets to the game against the San Antonio Spurs. That night is also HBCU night, when the Grizzlies recognize the contributions of historically Black colleges and universities. Wear your college sweatshirt and join us on Monday night. This is the end of our slides. Thank you for your attention, and I will take your questions now.
Alex Coleman, WREG. Alex Coleman, go ahead.
Yes, good afternoon, Austin. Dr. Taylor, I know you've had a lot of Shelby County and Memphis. We've had a lot of success with the numbers of cases decreasing recently. What about when it comes to MIS-C in children? What are we seeing locally these days? Have the numbers decreased enough, or have we seen an increase in MIS-C cases?
Great question, Alex. We have not seen an increase that I know of. That question would probably be more appropriately directed at Methodist Le Bonheur Healthcare, because they will have those exact numbers. But what I do know is that we are seeing all of the numbers drop across age groups, and we are really excited about that. Of course, we know that MIS-C is a bad outcome for our kids who have had COVID, and we have had some cases in the county. But as far as I know, those rates are decreasing along with our overall COVID rates.
Alex, your second question.
Thank you, Austin. Also, Dr. Taylor, when it comes to the distribution of the at-home testing kits, have we had a lot of response to it locally here in Memphis and Shelby County? And are a lot of people actually taking the time to report their results?
Well, I will tell you that we do have a significant number of folks who are reporting those at-home results, and we believe that this automated option that I just described during the slides will make that even more so. But we want to make sure that we're covering everybody. So for those who do not have internet access, they can still dial that 222-MASK number and be able to report their results. The reason why we want to encourage this is because we know that COVID is still with us. And so, and we know that a lot of people have received their allotment of at-home testing kits from the federal government. And so it's very important that folks are continuing to know their status so that we can keep these numbers contained. And if someone is positive, they know that they need to stay home for a couple of days.
Those are all of our questions in queue at this point in time. Are there any closing statements?
The only closing statement I have is to thank the people of Shelby County. You all have done a wonderful job. We are closing in on 2 years of a global pandemic, and I couldn't be prouder to be standing in front of you talking about the numbers being as low as they are and talking about all the ways we have learned to protect ourselves. And so continue to mask up when you're in public places where you do not know the vaccination status or the illness status of the people around you. Continue to test. If you think you're having symptoms and you don't want to spread virus to others, and just continue to take care of each other and yourself. Thank you.
Thanks, everybody. We'll see you in 2 weeks.